Welcome. Have you ever felt something irritating in your eye, like a grain of sand that just won't go away? Sometimes, it's more than just a simple irritant. Today, we're diving into a condition called foreign body reaction in the conjunctiva, exploring what it is, what causes it, and how it's treated. So, let's get started. Foreign body reaction in the conjunctiva, as the name suggests, is triggered by the presence of a foreign object lodged within the conjunctiva, the clear membrane covering the white part of your eye, and the inside of your eyelids. These foreign bodies can range from the mundane, like dust, sand, or eyelashes, to more complex materials such as metal shavings, wood splinters, glass fragments, or even retained contact lens fragments. Occupational hazards in manufacturing, construction, or farming significantly increase the risk. Even seemingly harmless activities like gardening or simply being outdoors on a windy day can expose you to potential irritants. The key element is the introduction and subsequent embedding of a substance that the body recognizes as foreign, initiating an immune response. Once a foreign body becomes embedded in the conjunctiva, the body's defense mechanisms kick in. This initiates an inflammatory response, the first line of defense against invaders. The conjunctiva becomes inflamed and irritated, leading to redness, swelling, and increased tear production. Immune cells like macrophages and lymphocytes migrate to the site to engulf or neutralize the foreign material. In cases where the foreign body is inert and small, the body might successfully encapsulate it with scar tissue, forming a granuloma. However, if the foreign body is reactive or not fully removed, the inflammatory response can become chronic, leading to persistent discomfort and potential complications. The prolonged inflammation can also damage surrounding tissue. While exact prevalence numbers are difficult to pinpoint, foreign body reaction in the conjunctiva is a relatively common ophthalmic presentation. Individuals working in certain occupations, like construction workers, metal workers, and farmers, are at higher risk due to increased exposure to airborne particles and debris. Contact lens wearers are also susceptible, especially if proper hygiene practices are not followed, increasing the chance of lens fragments or other debris lodging under the eyelid. Age and gender don't seem to be significant independent risk factors, but lifestyle and occupational exposures play a crucial role in determining individual susceptibility. The symptoms of a foreign body reaction in the conjunctiva can vary depending on the size, location, and nature of the foreign object. Common symptoms include a gritty or foreign body sensation in the eye. This is often accompanied by redness or injection of the conjunctiva, excessive tearing or watering, and light sensitivity or photophobia. Blurred vision may also occur, especially if the foreign body is located near the cornea. In more severe cases, you might experience pain, a feeling that something is stuck in your eye that won't come out, and even swelling of the eyelids. If you experience any of these symptoms, it's important to seek prompt medical attention. Diagnosing a foreign body reaction in the conjunctiva typically involves a thorough eye examination by an ophthalmologist or optometrist. The doctor will ask about your symptoms and any recent eye injuries or exposures. A visual acuity test will assess your vision. The examination will involve using a bright light and magnification, often a slit lamp, to carefully inspect the conjunctiva and cornea for the presence of a foreign body. Fluorescein staining, where a special dye is applied to the eye, can help highlight any corneal abrasions or areas of irritation caused by the foreign body. In some cases, especially if the foreign body is small or deeply embedded, imaging techniques like ultrasound may be used to locate the object. While there aren't strict classifications based on the reaction itself, foreign body reactions can be categorized by the type of foreign body involved. We can differentiate between reactions to inorganic materials like metal, glass, or sand, and organic materials such as wood, insects, or plant matter. The type of material can influence the severity of the inflammatory response. Some foreign bodies are inert, meaning they don't cause a strong reaction, while others are more reactive and can lead to greater inflammation and potential infection. Foreign bodies can also be classified based on their location: superficial, embedded, or penetrating the conjunctiva. The primary goal of treatment is to remove the foreign body and alleviate the inflammation. The most common method is irrigation, flushing the eye with sterile saline solution to dislodge the object. If irrigation is unsuccessful, the doctor may use specialized instruments, such as a fine needle or forceps, to carefully remove the foreign body under magnification. After removal, antibiotic eye drops or ointment may be prescribed to prevent infection. Anti-inflammatory eye drops, such as corticosteroids, can help reduce inflammation and discomfort. In some cases, if a granuloma has formed around the foreign body, surgical excision may be necessary. It's important to avoid rubbing your eyes, as this can further irritate the conjunctiva and potentially damage the cornea. Preventing foreign body reaction in the conjunctiva primarily involves protecting your eyes from exposure to potential irritants. If you work in an environment with airborne particles, always wear safety glasses or goggles. When doing yard work or participating in activities that may expose you to debris, consider wearing eye protection. Contact lens wearers should follow proper hygiene practices, including washing hands thoroughly before handling lenses, cleaning lenses regularly, and avoiding wearing lenses for extended periods or while sleeping. Regularly cleaning your environment, especially around the eyes, can also help reduce the risk of exposure to foreign bodies. And finally, be aware of your surroundings and take precautions to avoid eye injuries. The prognosis for foreign body reaction in the conjunctiva is generally excellent with prompt diagnosis and treatment. Most patients experience complete resolution of symptoms within a few days to a week after the foreign body is removed and inflammation is treated. However, if left untreated, the condition can lead to complications such as corneal abrasions, infections, or chronic inflammation. Recent research is focusing on developing more effective and less invasive methods for removing deeply embedded foreign bodies. Advances in imaging technology are also helping to improve the accuracy of diagnosis. Furthermore, research continues on developing sustained-release anti-inflammatory medications that can provide longer, lasting relief and reduce the frequency of eye drop application. Always consult with your eye care professional for the most up-to-date information and treatment options. Thanks for watching.